Healthcare costs on the rise in America due in large part to rising premiums of the Affordable Health Care Act. Now Americans are turning to short-term health policies as an alternative to the traditional plans purchased through the exchanges. In fact, sales of short-term plans last year were 150% higher than in 2013. Joining us right now to explain the move towards short-term policies is former New York Lieutenant Governor and the author of Beating Obamacare, Betsy McCaughey. Good to see you.
Good to see you.
Thank you so much. And you brought along the Affordable Care Act.
Yes, it is not so affordable, which is why consumers are fleeing to what are called short-term plans. And the reason is that they don't want to pay for all the costly and unwanted benefits crammed into this law.
I mean, this is 2,000 pages.
2,572.
And one of the things that people were saying the whole time when they were pushing this through, Dagan, is that the lawmakers didn't even read it.
No, how could they read it? And they clearly didn't. And when you piece together this kind of really hideous patchwork quilt of laws, you don't really know the outcomes. And we're just, again, beginning to see, even with the Cadillac health care tax, the 40% excise tax that was supposed to be put in 2018 has gotten kicked down, delayed a little bit, because lawmakers are worried, particularly Democrats, of what that's going to do to the cost of the employer health insurance market.
So walk us through what's been happening.
Okay, well, this is, as what our president would say, a teachable moment. And two of the lessons are that Americans don't want this one-size-fits-all Washington-designed health plan that includes things like pediatric dental care, even if you don't have kids, maternity care, even if you're a man or a family that's too old to have kids, substance abuse programs, even if nobody in your family has any desire to take drugs.
You're forced to pay for all of that.
You're forced to pay for all those things. That's one of the things that's made these plans so unaffordable. The other is, don't try to sell the same plan to someone who's healthy and someone who has chronic illness for the same price. It's like saying I can feed a Chihuahua and a Great Dane for the same price. You just can't. About 5% of the people in this country consume 50% of the health care because they're very sick. You can't sell plans to sick and healthy people for the same price, or the healthy people run away, and that's exactly what's happening here.
So they're choosing, more and more Americans are choosing these short-term health policies. Right. Do you recommend that? Is that what people should be doing when they see their Obamacare prices going up?
I can tell you it's a great deal if you're young and healthy and you don't plan to get pregnant.
Go for the short term.
That's right, because then if something, God forbid, happens, you are legally entitled to sign up for the Affordable Care Act.
But if you go for the if you go for the short-term plan, you still have to. Then you get a penalty.
You get a penalty, but these short-term plans are less than a third of the price.
Even with the penalty.
Right. Well, after you add the penalty, it's still a good deal. It's still a good deal, but you can't find them everywhere, Maria. You can't find them in New York. You can't find them in Massachusetts. In some states, people are literally captive to their own state laws that prevent them from buying these affordable plans as well.
Betsy, are any lawmakers talking about this, saying about this short-term plan getting a penalty?
Well,
is anyone else talking about this?
Chances are the do-gooders in states like California will try to make them illegal once they realize what's going on.
Well, what's the solution here? Is it cutting that binder in half or tossing the binder?
The solution
it's a good question
is repealing Obamacare and letting Americans choose the kind of health insurance they want.
So free markets.
That's right.
But you know that's not going to happen. If a Republican gets elected to the White House, repealing Obamacare, because this is a train that has left the station.
No, if a Republican gets in the office, you don't think it'll happen?
Only 11 million.
I think it's very hard to completely rip it up.
You're wrong. 11 million people out of a population of 318 million have signed up for these plans. It's minuscule.
Okay. Wow.
And in fact, this Obamacare, it's already in a death spiral.
Secretary Clinton, Hillary Clinton, says she's not going to repeal Obamacare. She's going to add to it, build on it.
The insurance companies may repeal it. 5 out of the 6 big insurers have already signaled that they are heading for the exit because they are bleeding red ink trying to sell these dogs.
Well, this all goes to the point, though, of how do you pay for this when you have people who are sick, who aren't paying more money for their policies.
But you can't force consumers.
They've tried to make healthy individuals, that's part of the math, cover the cost of people who are very, very ill and who, some of them don't take care of themselves. Well, it doesn't work.
That's right. A 30-year-old man who's stuck with one of these bronze plans that has a $6,000 deductible per person is never going to get a penny back for all the premiums he pays. He might as well pay for car payments instead.
The crazy thing is you have two big health insurance mergers going on now that, to help economies of scale and get these guys going, maybe make it survivable in this regime. And yet now the regulators, the same allies of the folks that enacted this, are saying, no, you can't merge. That's not good for consumers. Yeah. That's called bye-bye. We're not going to do anything.
Let me ask you, before you go, we've been talking a lot about these high-tax states where people are just leaving in droves. I mean, we reported that David Tepper is leaving New Jersey. It's causing 140.
New York, Connecticut.
Right. So what's your take on it? I mean, coming from, being the lieutenant governor of New York, I mean, the tax story,
people are voting with their feet. You can see Connecticut is the latest. Businesses are moving out of Connecticut.
General Electric just left Connecticut.
That's right. And the populace is leaving Connecticut.
What about New York?
Taking a nosedive in Connecticut. New York, a little less so. The latest New York State budget gave a little tax relief to the middle class. It's not great. New York is still one of the heaviest tax states. But this whole Northeast corridor has an anti-business aura about it. They're controlled by Democrats, and they're taxing the heck out of everybody.
Yeah. Betsy, good to see you. Thank you. Thanks so much for joining us. And thanks for bringing the mother of all books to us.
Next time, give us a 20-page bill in plain English. Right?
Yeah, thank you.
Betsy McCaughey. I'll summarize it later.